After part 1, we come to the next part. It is patients have rights. Patients have rights. They are a lot of rights. They are real rights. Let's explore these rights from a new point of view. We'd like to quote an ancient Greek philosopher, Epicurus. He said, "The art of living well and the art of dying well are one." So, when terminally ill, who will have the last say at the end of life? We'd like to watch a video clip taken from the Mayo Clinic. Please think about who will have the last say.
If something happened, and suddenly you were unable to speak for yourself, and important decisions had to be made, decisions that affect you, who would you want to speak for you? And how would that person know what you would want, unless you'd chosen that person in advance and made those decisions in advance? An advance directive is a form that you complete now to help your family in a difficult time. It tells your healthcare providers who you want to speak for you and what you want and would not want in different situations. The first step is to talk with your family about these issues. Decide who you want to speak for you and what your goals are for your healthcare. Your healthcare provider can be very helpful, explaining situations that might occur and what your options might be. Then, fill out an advance directive form. Have your signature witnessed according to the laws of your state. Then give your advance directive to your healthcare provider to be added to your medical record. Be sure your family members have a copy so it can be easily accessed if the need should arise. It's never too early to complete an advance directive. You can revise this document anytime you wish. You may never need it, but if something should happen, your family will be grateful that you made decisions for yourself in advance. Ask your healthcare provider for an advance directive form today.
After watching this video clip, we think it is a good idea to put your health care wishes in writing in case you are not able to speak for yourself. Let your wishes be known. Get an advance directive. Get a what? Yes, get an advance directive. What is that? Let's find out. Advance directive, these two words. Advance is an adjective. It means done or given before an event happens. Directives, it's a noun. It's an official instruction. So combined together, advance directive are an official formal instruction given before an event happens. In our course book, in paragraph 3, advance directive is illustrated in the Federal Patient Self-Determination Act. This act went into effect in 1991. This act mandates that all hospitals, nursing homes, and home health care providers are required to inform patients of their rights as patients and their ability to make an advance directive regarding their health care to treatment. There are two basic documents to set out your wishes for medical care. One is living will. In Chinese, 生前预嘱. The second one is durable powers of attorney. We call it 永久委托书. Both documents are healthcare advance directives. These documents can let you specify your wishes for healthcare in case that you became unable to speak for yourself. It is wise to prepare both. These documents, living will and durable powers of attorney, they are written legal instructions describing your preferences for medical care if you are unable to make decisions for yourself. And these documents can guide choices for doctors and caregivers if you are terminally ill, serious injured, in a coma, in the later stages of dementia, or near the end of life. In determining your wishes, please think about how important it is for you to be independent and self-sufficient. What do you feel would make your life not worth living? And would you want treatment to extend life in any situation? Would you want treatment only if a cure is possible? Having discussions with your doctors, your families, and friends about your personal wishes. It's your life, your wishes. It all starts with a conversation. Make a number of possible end-of-life care decisions in your living will. Talk to your doctors if you have any questions about the following issues. The first issue is resuscitation. Starts the heart when it has stopped beating. Determine if and when you would want to be resuscitated by electric shock and by CPR, that is cardiopulmonary resuscitation. The second issue is mechanical ventilation. It takes over your breathing if you are unable to do so. Consider if, when, and for how long you would want to be placed on a mechanical ventilator. And the next issue is tube feeding. Tube feeding supplies the body with the nutrients and the fluids intravenously or via tube in the stomach. Decide if, when, and for how long you want to be fed in this manner. Here comes the next issue, is dialysis. Dialysis removes waste from your body and manages fluid levels if your kidneys no longer function. Determine if, when, and for how long you would want to receive this treatment. Number 5, the issue is antibiotics and antiviral. Antibiotics or antiviral medication can be used to treat many infections. If you were near the end of life, would you want infections to be treated aggressively, or would you rather let infection run their course? Issue number 6 is comfortable care. It is also called palliative care. It includes any interventions to keep you comfortable and manage pain, while following your other treatment wishes. This may include being allowed to die at home, getting pain medication, being fed ice creams to soothe dryness. Issue 7 is organ and tissue donation. Donations for transplantation can be specified in your living will. If your organs are removed for donation, you will be kept in a life-sustaining treatment temporarily until the procedure is complete. To avoid the confusion, you need to state in your living will that you will understand. The last issue for consideration is donating your body. Donating your body for scientific study also can be specified. Contact a local medical school, a medical university, or donation program for information on how to register for planned donation for research. By planning ahead, during moments of crisis and grief, after discussion, after decision, we have clear directions. You can get medical care you want. You can avoid unnecessary suffering. You can relieve caregivers of decision-making burdens, and you can help reduce confusion and disagreement about the choices you would want people to make on your behalf. Advanced directives are not only for elder adults. Unexpected end-of-life situation can happen at any age, so it is important, it is wise for adults to prepare these documents. Just now, we have mentioned there are 2 basic documents to set out your wishes for medical care, living will and durable powers of attorney. Let's deal with them one by one in detail. The first one is the living will. What is living will? In our paragraph 4, we can find the definition. The living will is a document which tells your physician or healthcare givers what types of treatment you want if you become terminally ill. And this living will can outline the types of treatment you want and what you don't want. It also can name a person as a proxy to make these healthcare decisions for you. When does the living will take effect? The answer is in paragraph 6. Keep in mind the context for which the living will was developed. Remember, it is not in emergency room. It's not in the operating room, but it is when the patient is out of intensive care and be kept alive with machinery. It is that situation for which living will was created. In the next paragraph, paragraph 7, the author says, a living will became legally enforceable when the patient can no longer decide treatment decisions for himself and is terminally ill. This means that the patient is in an incurable or irreversible condition for which treatment would only prolong dying. The author gave more examples in paragraph 8 and paragraph 9 about when the living will takes effect. The living will does not apply in ER, that is emergency room. The living will does not apply in OR, that is operating room. How to make a living will? We will find the answer in paragraph 24 and 26. Here are several frequently asked questions about how to make a living will. The first one, who can make a living will? Who can create a living will? Generally speaking, anyone who is at least 18 years old and of sound mind can create a living will. In this context, sound mind usually means the ability to understand what the living will is, what it contains, and what it does. When is a living will useful? Living will is useful when you want to specify your wishes so that it is more likely they will be carried out. You are facing the possibility of surgery and hospitalization, and you want to create a complete estate plan, and you have been diagnosed with a terminal condition. A living will be very, very helpful and useful. How will my doctor decide that I can't make decisions for myself? This doesn't have to be verbal communication. Actually, any expression of your desires will be sufficient, including a nodding or a shaking. It is required that the doctor to explain this decision in writing before any medical treatment can be carried out. Whether you can make a decision based on the doctor's information, whether you can understand what the doctor is telling you and the consequence of any decision you're making, whether you can tell your doctors that you have decided, both verbal communication and body language. The next question is, can I name my healthcare provider as my healthcare agent? No. Laws usually prohibit you from naming a healthcare provider your agent. Employees of your provider or your provider's owner cannot be agent either, unless they are related to you, they are your relatives. Are there any decisions my healthcare agent can't make for me? In addition to any specific prohibitions you include in your living will, your healthcare agent cannot put you a mental health facility. He cannot authorize extreme psychiatric treatment or surgery. He cannot authorize sterilization or abortion. And he cannot authorize any mercy killing, euthanasia. He cannot authorize any act that goes beyond what you authorize in your healthcare power of attorney. Will my living will ever expire? Your living will remain effective for as long as you live, unless you intentionally revoke, here it means cancel it, or the court gets involved. If you named your spouse, your husband or your wife as your healthcare agent, yet later you get divorced, It might be a good idea to create a new living will after your divorce, so there will be no confusion. How can I change or revoke, cancel my living will? You can change or cancel your living will whenever you want, as long as you are of sound mind and not under any undue duress or influence. Duress, that means you are forced to do something, you are threatened to do something. Should I notarize my living will? Because of the severe consequences associated with the living will and the important decisions outlined in it, some people choose to have their living will notarized and signed by witnesses. Do doctors and healthcare providers really pay attention to my living will? Generally, healthcare providers and doctors are required by law to follow the directives in your living will. It is a good idea to talk to your doctor about the documents and make sure that he or she is willing to follow the instructions you have included. After you have completed your living will, schedule an appointment with your doctor to go over it. So much for the living will. Then we come to the second document, that is durable power of attorney. Here is a sample of durable power of attorney for healthcare. What is the durable power of attorney? We can find the definition in paragraph 21. It is a signed, dated, witnessed paper naming another person to make decisions for you. Any competent person over 18 years old can be chosen. The person does not have to be an attorney, to be a lawyer. You should choose a person who meets the following criteria, because you know choosing a person to act as your healthcare agent is important. Even you have other legal documents regarding your care, not all situations can be anticipated, and some situations will require someone to make a judgment about your likely health care wishes. The following criteria, they are, this person should meet the legal requirement for healthcare agent, and he is not your doctor or part of your medical care team, and he is willing and he is able to discuss medical care and the end-of-life issues with you. He can be trusted and make decisions that adhere to your wishes and values. He can be trusted to be your advocate if there are disagreements about your care. Advanced directives, so many choices for you. Living will, durable powers of attorney. Maybe you're a little bit confused. So let's pause a little bit to think about what are the similarities and the differences between a living will and a durable power of attorney. They do have a lot of similarities. A living will is similar to a durable power of attorney in the following three aspects. Both documents allow you to choose someone you trust to make certain medical choices on your behalf. And to make both documents, you must be at least 18 years old and you must be of sound-minded. Meanwhile, a living will is different from a durable power of attorney. A living will is generally limited to deathbed concerns only, the terminally ill at the end of life. However, a durable power of attorney for healthcare covers all healthcare decisions. It lasts only as long as you are incapable of making decisions for yourself. That is why it is wise for us to have both. There's an old saying, where there's will, there's a way. After today's discussion, we know where there's a living will, there will be a way to make all your medical decisions known.